Perfect. Alrighty. So let me share my PowerPoint with you guys so that you can see some of the information. And then just let us know if you have any questions. You guys can type along in the chat box and we'll have someone answer any of the questions that you might have. Do you guys know where the chat box is on your Zoom? Okay, yeah. Perfect. Alrighty. So to start off with, my name is Leilani Okihara. I'm a physical therapist here at M3 Physical Therapy. And let me get my screen started. Perfect. Let's do this. Alrighty.
She's sharing.
Oh, okay.
Yes. Are you guys able to see the screen right now?
Yeah.
Perfect. Alrighty. So let's kind of start off with, so what the sciatic nerve is, that you guys might be having some discomfort with sciatica. The sciatic nerve comes from the back region, right, in the lower back region, and it goes down the leg towards the back and towards the side of the leg into the foot. It's the longest nerve in the body, and it provides control for your muscles and also some sensation to the skin as well. And let me do this. Perfect. And so what is sciatica? So sciatica is when there's an irritability happening to the sciatic nerve, whether that's through like inflammation or some sort of compression or some sort of pinching that's happening along the nerve in its tract that goes down to the foot. So some of the experiences that you might be feeling is some shooting, numbness, tingling. Any of those side symptoms you might occur through the back, into the butt region, down the thigh, and into the legs, into the foot. Let me come back here. All right. So some of the main causes of back pain and sciatica. So these are kind of the three most common ones, with disc injuries being the most common one. Another one called stenosis, or any arthritic changes into the back, and what we call is the sacroiliac joint. There's also other forms of low back pain, but these are some of the ones that we're going to be focusing on the most today. Let me know if you guys have any questions along the way as well, okay? All right, let me do this. Perfect. All right, so for the most common one is the herniated disc. So typically, are you guys able to see the mouse on the screen?
Yeah.
Okay, perfect. So this is your typical disc that we have between the different back bones in your body. So this is kind of that normal height one. And the ones I will be kind of discussing right now is the herniated disc and the bulging disc. I want you to think of the disc as a jelly-filled donut. So when you kind of squeeze that jelly donut, if you squeeze it too hard, parts of the jelly will come out of the jelly donut. And that portion is right here in the back. And you have your spinal cord that comes right in the back here with all the nerves. So if part of that jelly donut is being taken out, it's going to compress on that nerve that comes down your leg as well. Ooh, let me put this here. Hold on real quick. So things that can happen is with an injury, if you're, say, you're bending forward with a quick movement, you might cause some of that discomfort, or say that you fall into your buttocks with your back kind of flexed, you might have that as well. Or it could be a slow progression as well. Typically, these kind of patients are younger, usually less than 50, but you'll also get that discomfort in a sitting position or driving or sneezing or coughing. So if you feel like this might be something that's irritable to me, and you know, it's like, okay, if I stand up straight, it feels better, this can be a related injury for you guys as well. So some of the treatments that we do. So in the acute phases in the very beginning, sometimes using some ice or heat, or what we call a TENS unit, which is, I don't know if you guys had it before, it's these little electrical stimulations that we can put on that area in the spine, on your skin, and it sends little shock waves to your skin to kind of block those pain receptors that go to your brain, to decrease that threshold of discomfort, to give you some relief momentarily in that position. We also do manual therapy, so working on different muscles that might be pretty tight, causing some irritability and decompressing that nerve as well. And if it's super highly irritable, collaboration with like your physician on getting medications such as NSAIDs is useful as well. What we would also be doing too for some of the treatment here is we work on your body alignment. So getting you out of these positions that's causing strain on that disc and that nerve and causing those symptoms with your day-to-day activities. So for here, sometimes what we would do for this kind of situation is what we call the McKenzie method of using extension-based exercises. So say that if you're laying on your stomach, that's more tolerable, or being in more a standing position compared to wanting to bend down, or if you're sneezing, driving, those symptoms as well. We'll also be working on a little bit of what we call nerve mobility. So sometimes the nerve, when it's being irritated, it's being stretched and pulled, but that's not what the nerve wants to do. What we want the nerve to do is be able to move back and forth and glide. So if it's being stretched too much, then it's just going to be sending all these pain receptors to different parts of your leg, different parts of your body, and those are some of the symptoms that you will be experiencing. And we would also be working on some of your hip and core strengthening, because that's going to help give that stability in that spine of yours. So I'm going to have an assistant come out and show you a couple of exercises that we typically do. So hold on real quick. Okay. All righty. So are you guys able to see our patient at the time? Roll. Okay. Perfect. All right. So for him, say that he has like a herniated disc issue, being in the position of being forward might be irritable, or being in a driving position might be too much. So one of the things that we can do is try to put him on his stomach so it's a little bit more comfortable. So roll. So we call these prone press ups. What I'm going to have you do, Rose, I'm going to have you onto your stomach. I'm going to put a little pillow right underneath your legs real quick for you. Perfect. And so I'll kind of check in with him to see how he's in this position. If this is in the beginning, this is open tolerant, we'll kind of work from here. If this position is okay, then we'll start to increase the intensity of it. So the next thing I'm going to have you do is I'm going to have you prop yourself up onto your elbows just a little bit for me. Perfect. So that we get him into more of an extension-based position compared to being bent over in that driving position or the sneezing position as well. Then from this position, we're going to do, if he's able to do, we'll do about like 10 reps of coming up and down. So you're going to come up, and then you're going to slowly come down. Good. Go ahead and come up. Good. Slowly come down. How's your symptoms going right now, Ro? Anything going down the leg? Perfect.
Feels better.
So if this position works, we're going to want our symptoms that go all the way down to his toes. We want them to start to travel back up towards the spine to where the source originates from, rather than it spreading down the legs. All right, thank you very much. Go ahead and come on up. Perfect. Did that exercise make sense for everybody so far? Perfect. So the next one that we'll talk about is stenosis or arthritis or degenerative joint disease or disc disease. So this is common in older generations for about 50 years or older. And it's when the space between the vertebrae, the different bones in the back, starts to narrow, and that nerve can't be gliding and sliding like we want to. So it's getting some kind of impingement in that region. So right here is what a typical piece of your back looks like. And right in the middle is where the spinal cord will come down. What happens with stenosis is that space right in the middle decreases. So that's when that nerve isn't able to be pulled through back and forth. So I want you to think of a hose. If there's like a kink in the hose and you can't move that hose back and forth, that water is not going to be able to go through the hose as much as it should. And that's that type of nerve as well. So typically with these patients, it's what we call like that grocery store pushing cart position, where they like to be bent over more so than being standing up nice and tall. They like to sit more than stand. Standing will cause those symptoms to come down the legs as well. Put this guy here. Perfect. So some of the treatment that we do for stenosis and the arthritis is first, again, kind of the ice or TENS, if that helps to decrease some of that inflammation in that TENS unit as well. Working on the manual therapy, so working on those muscles or that joint specifically of where that nerve is being decreased in that space. And then again, if there's high irritability, talking with your physicians about getting some kind of medication or NSAIDs or inflammatories as well. For here, we would talk a lot about patient education on positional changes and movements to decrease that strain on the different nerves and the different joints. So we would be promoting safe positions, getting you more in this flex position as well, rather than being upright and feeling like, ooh, my back, I feel like I can't stand up too long. I'd rather be in a seated position or bending over more so. And then we'd also get you in different sideline positioning as well to open up some of that space between the space in the bones in the back to decrease that strain on the nerves. And then again, same thing with the other herniations. We'll be working on that nerve mobility. So getting that nerve to move back and forth rather than it being compressed. Oops. Hold on real quick. Then let's do this. Then we'd be working on what we call traction, just increasing some of that space between the joints so that the nerve also glides as well. And then again, improving some of that core and hip strength, because the core and hips stabilize so much of the spine. And what happens when those are weak, the spine will take on a lot of that demand and just continue to decrease and impinge some of those nerves on the back. So let me show you an exercise that I'll typically do with the patients to kind of start off with as well. Oops, hold on real quick. I think there's someone in the chat. I'm not sure. All right. Perfect. So someone with stenosis, they won't necessarily like being in a standing position. And so they typically like to be in a seated position. So in this position, being in a more flex position is more comfortable for them as well. So in this position, Raul, I'm just gonna have you slowly kind of just bring your arms towards your legs and slowly come down. Coming down like this. And now it's going to create space in the back so that those nerves can go up and down rather than it being stretched like a rubber band. Go ahead and come back up. Good, nice and slow. And I'll typically have them do it about 10 times if they're able to tolerate it. So go ahead and come back down. Good. Go ahead and come back up.
One moment there.
Yeah. Go ahead and come back down. And I'll check in to see how they're doing as well. So how is this feeling for you, Raul? Any increase in symptoms or does it feel pretty good?
Okay.
Good. Go ahead and come back up. Alrighty. And go ahead and take a break. All right. Any questions so far? No. Perfect. Alrighty. So then this next one is what we call our sacroiliac joint dysfunction.
Hi, can you hear me?
Oh, yep, we can hear you.
Questions on chat.
Oh, okay. Hold on real quick. Oh, perfect. Okay, so for the ice and TENS, we'll typically put it right where along the spine and the back region. Typically, it's usually around the low back region, or sometimes if it's like towards the hip of where different symptoms are. Oh, sorry. For everyone, the question was, where do you apply the ice and the TENS? And what about holding the bend? So for the I's and the 10s, we'll target the tissue that's most irritable. So if it's whether it's in the low back or maybe if it's kind of more in that glute or hip region, we'll kind of typically put it there, and we'll put it for like 10 to 15 minutes on and then kind of come off of it just to kind of decrease that pain threshold. And then for the bending forward and up, we like to go nice and controlled. So I don't want them just coming up and down too quickly. I kind of like to do like a 5-second count coming down, seeing how they're able to kind of tolerate it. And then you can hold it for a few seconds there and then slowly come back up as well. All right, perfect. All righty. So this next one is the SIJ, what we call the sacroiliac joint, which is right at that tailbone region and then part of the hips. So it's going to be right in this region right here. And this typically affects females more than males, and it could be usually around 20 to 40-year-olds or people pregnant or postpartum, because with the pregnancy and postpartum, you get a lot of laxity within a lot of these ligaments right here, causing some movement between the tailbone and then that hip joint right here. So what happens is you get a pelvic obliquity where maybe one portion of the hip is kind of coming forward or up or down compared to being even. This can typically come from a fall, stepping off a curb too hard, and you feel like a jolt in that hip, in that back region, a car crash, or again, pregnancy as well. You'll feel this typically with bending forward if you have to pick up things, twisting too quickly, sitting in too long of a prolonged position, or transition. So coming up from the ground, standing up from a chair, or just moving laterally side to side as well. Perfect. So for some of the treatment that we do here is first we'll kind of look at their hip, see, okay, which hip may be more malaligned than the other? Is one side rotated more than the other? Is one coming up, one coming down? We'll use manual therapy to help normalize that pelvic alignment so that the hips are more at an even playing field rather than one being high, one being low. Once you start to normalize that pelvic alignment, then we're going to be working on the flexibility and the strength that surrounds those bones to keep that stability and keep that position and maintain that symmetry. And then from there, we'll start to progress towards exercises for more functional related things to more patient specific goals that they would like to get back into. So let me show you a technique that we do with some of our patients.
Very reminiscent.
So say that this is the front of your pelvis, and then this is the back of the pelvis, the back region. What happens is maybe one portion of the hip might be kind of bent forward or backwards, or it might be up or down. So I'm going to show you a technique that we use. So for our patient here, say that his right hip part is being rotated forward and it's not necessarily even. So let me kind of show you. So roll, go ahead and bend your knees for me. What I'm going to have you do is you're going to put both of your feet on top of my legs here. Right here. Perfect. In this position, I'm going to be having him push his right leg into my thighs, and his left leg is going to come up towards his chest. So roll, go ahead and go up. You're going to go, 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 and then relax. Good. Go ahead and go again. 1, 2, 3, and relax. Good. Go ahead and go again. 1, 2, 3, and relax. Good. I'm going to relax here. And then I'll have my hands right between his knees, and I'm going to have you squeeze as hard as you can for a couple seconds. And then relax. Go ahead and squeeze. And then relax. And then go ahead and squeeze. And then relax. And then I would check his alignment again. So now I'd have him come back down, kind of checking here. And then I'll check his pelvis region to make sure it's aligned well. All right. Good. Go ahead and come on up. Perfect. Alrighty, so let's do this. So were you guys able to see that perfectly fine? Oop, let me do this. Alrighty, any other questions regarding that?
Nope.
Perfect. Alrighty, and so from there, as we kind of get that pelvis to be more aligned. So here we're looking at them being level with each other, the pelvis region. As that is aligned again, then we'll kind of work on increasing the strength in the abdomens and the core, and then strengthening the hips along with it as well to keep everything nice and intact so that you don't get that up and down or rotatedness. Perfect. All right. So questions on, does anyone have like difficulty sleeping where they feel like discomfort go down the legs or anything like that?
Not yet.
So these are some of these positions that you could go into if you start to feel some of that discomfort. So say that you feel it coming down the back of your legs into the foot here. I suggest maybe try propping some pillows underneath the knees and seeing how that feels to decrease some of that strain on the nerves that come from the back all the way down the legs. So just putting some pillows here can help decompress and prevent that nerve from feeling like it's being stretched too much. For this position, if being on the back is too uncomfortable, or say being on your stomach is too uncomfortable, you could try being on your side. So maybe there's one side more than the other that's more comfortable. And typically what I found with some of my patients is the side with the most discomfort, they don't like to lay on that side. So I'll tell them, okay, try laying on the side that's most comfortable for you and putting a pillow in between your legs and seeing if that helps as well. So these are a couple positions that you guys can try at home if you have difficulty sleeping because you start feeling those sharp shooting pains going down the legs. Alrighty. So a big thing is work environment setup. So especially with COVID, we're doing a lot more sitting around, not getting up too much, or now you're working from home compared to working in the office. So some quick chair fitting tips. Making sure your back is supported. So making sure that knowing that one size does not fit all. So one chair for me doesn't necessarily fit for everyone else. So finding a back support that helps with your specific curvature. Having a seat as well that's comfortable. So you don't want one where you feel like you're sinking into it and you can't get up. And that's the same thing as if you're on the watching TV on the couch where you feel like you're sinking too much in it and it's too hard to get up. So that might be an indication that might not be a good place for you to be sitting for prolonged periods of times. And then finding a position also, or chair that's not too hard. So not a chair that might be like too hard, say a wood chair might be too irritable for some people where they're sitting and it's putting a lot of compression right on that nerve. So finding a good chair is really important for that. And then armrests. Armrests are really important for chairs. So you want to make sure the armrests are comfortable so that you don't feel your arms are shrugging up towards your shoulders. They can be nice and relaxed and they can be comfortably set if you have to do a lot of typing or work at the desk. And then a strong and sturdy base for your chair. So making sure it's not too loose and that it gives you a lot of support where you feel like I can sit comfortably without it feeling like it's going to topple over. And then a big thing as well is making sure that the seat is wide enough and there's not too much pressure on the outer portions of your legs, but it's also not too narrow, so it's comfortable as well. So let me show you a picture. So this will be in like an ideal setup for some people. So making sure your feet are flat on the ground, your knees aren't up towards like your waist too high, not too low. It's nice and kind of as close to like a 90-90 position. Having a little backrest that fits to your curvature. Again, armrests and where the keyboard is flat, so it's not too high, not too low. And then a big thing as well is where the screen is compared to your vision. So you don't want the screen to be too low where you're kinking your neck and then you could get neck issues, or where it's too high where again, you're kinking your neck and you're feeling like you're getting too much strain on your neck as well. And then again, keeping the shoulders nice and relaxed. So if sitting is too uncomfortable, then I would also suggest maybe a standing workstation as well. So something that maybe you can get like a high-low table. So if the table is at your standing height, you want it to be around your elbow level height as well. So again, your shoulders aren't hunched up too high, or it's not too low, or if you're like, I'm typing like by my knees or anything like that. I also suggest having like an adjustable chair standing behind you, or even a stool nearby so that you can sit as needed as well. And then same thing again, having the monitor and your keyboard at an optimal level, so it's not too high or not too low. And then maybe even having a step stool or a mat nearby so you could place your feet on top to change positions. I also suggest putting a timer, whether you're sitting or you're standing, set a timer so that you can get up every 30 minutes. And whether that's just walking to the kitchen, walking to the restroom, getting a snack, change positions. That's important regardless of what position you're in at a time. So for this one, the standing position, again, keyboard's at an optimal level, standing up nice and tall, keyboard or the screen isn't too high or too low. And then sometimes I'll have them put like a little step stool here so they can put one leg on top, just to kind of give you guys a little bit of a break so you don't feel I'm standing way too long or sitting for way too long as well. And then, yeah, so again, being in one position, not good for anybody. So make sure you get up and down as frequently as possible because you want healthy nerves, healthy muscles, and that's going to be a key component for any kind of condition as well. So here are a few exercises that you could even try out when you're kind of sitting for too long at a time. So just stretching and doing different positions just to get the body moving so you don't feel like you're stagnant and staying in one position way too long as well. So here are a couple that you could try out. Just again, just getting up is the most important thing at a time. And perfect. And so I would say don't wait too long for some of the back discomfort that you have. Early physical therapy intervention is really important because it can decrease your risk of having to go and get multiple MRIs, multiple x-rays, because sitting in those machines isn't too fun. Having to go to the doctors or like even wait months and months to see doctors isn't fun as well. And avoiding surgeries or injections or opioid medications as well. And then most importantly, it's good to come in because then we can get you back into doing some of the functional activities that you want to get back into doing rather than it being too long and then you're just being in more discomfort way too long. We want you getting back to doing the activities that you like to do. So let's do this. Perfect. So I think if this is something that's interesting you, I think for you guys to come in, it would be really good. So if you guys would like to schedule an evaluation, at the evaluation, you'll get one-on-one time with the physical therapist here at M3 Physical Therapy. Would get like your subjective report of how long you've been experiencing some of this discomfort, what are the different type of symptoms that you've been experiencing. We'll do a full evaluation. So looking at your posture, checking the strength, checking your alignment, checking where that source of where that nerve is getting irritated and targeting that source to decompress it, whether it's in the back or down the leg, just figuring out where it is so that we can get you better. And then starting treatment right away, right in that first eval. So in that first eval, we'll get that information from you, take those tests and measurements, and then start treating you right away so that you can leave our office on the first day feeling better than you came in as well, and answer any really in-depth questions that you might have later on that might come up. If you're not ready to necessarily commit to that, we do free screens where we'll talk to you a little bit about what you've been experiencing and do like a little tests and measurements of it as well. But the only thing with the free screen is we don't do treatment right away. So those are two options that if you guys would like to try out here at M3 Physical Therapy, I really encourage you guys to try it out. We have two clinics. One clinic is in West Hills and then one clinic is in West LA as well. Do you guys have any questions or anything like that?
No. No questions for me. Thank you.
Perfect. Like this. Oh, let me check this out. Hold on real quick. I think there might be a few things. Oh, perfect. Okay. Alrighty. So yeah, if you guys have any questions or if you guys would like to come in for evaluation, give us a call or shoot us an email, and then we can get you guys all set up. All right.
Thank you very much. I'll be leaving now. Thank you.
Alrighty, no problem.
Good job.
Oh, thank you. It was good to
Bye-bye.
meet you.
Bye.
Bye-bye. All right. Perfect. And then, Ginny, any questions or anything like that?
Not really. I have surgery scheduled in about 10 days I have this scoliosis and
Oh, okay.
a lot of pain, and so I'm going to a neurosurgeon in
Okay.
West Hill, and I'll probably be seeing you guys after that surgery.
Okay, well, we look forward to seeing you when
Yeah.
after that surgery.
Mhm.
Yeah, we look forward to seeing you here.
Thank
Let
you.
us know if you have any questions or anything before your surgery or right after, anything like that.
Okay, I
All
will.
right,
Thank
Ginny?
you.
All
Thank
right,
you.
best of luck. Awesome. And then any questions, Kenneth?
No, I'm already getting help from Chris and Erica, and I very much appreciate it.
Oh, perfect. Awesome. That's great to hear. All righty. Well, if you guys don't have any other questions, I'm going to go ahead and stop my screen right now, and hope to see you guys in the future.
So long.
Yes, thank you for the presentation.
Absolutely.